You know what? So it's going to be a great opportunity for our employees. We know that first and foremost, educators continue to be on the front line every single day. They put themselves in a in a position to be exposed to COVID-19, and they're doing it in a graceful manner, a heroic manner. And what this initiative is all about is be able to address educators who hit the first tier identified by the governor's office, or 65 years or older, to be able to have an isolated opportunity to be able to obtain the vaccine. Let me be very clear. I sent a letter to the governor on December 17th, asking him to make it a priority for every educator throughout the state of Florida and within Hillsborough County to be able to allow them to have accessibility to the vaccine. We know, and I agree with the governor's office related to taking care of essential workers, related to healthcare practitioners, mental health practitioners, along at the same time with those who are 65 years or older. But if we're going to ask teachers, support staff, leaders, district staff to be in schools and to have schools open every single day, then we should be able to make certain that we provide this vaccine and have it available for not only those who are hit a certain threshold, but related to age, but for every individual that is working in a brick and mortar setting connecting with children. This is another tool that we will leverage to be able to combat and mitigate COVID-19. So from our perspective and my job is to be the greatest advocate for the 25,000 employees that are under my umbrella, that work with me side by side to be able to create the best experiences for children. And this is just another opportunity for us to do it.
Are you frustrated that you can't get the governor or whomever to roll out this vaccine for all educators, not just those 65 and older?
I think the biggest thing is to continue to educate the governor's office about the overall importance. But I also know there's a balance. I'm very sensitive for those individuals right now who may be struggling, who may meet the tier 1 threshold, who may be struggling to be having the accessibility as well. If I can help in that process with the Department of Health to be able to have additional vaccines ready to be able to address that front tier, I'd be there being that advocate as well. But right now, the way that we sit, we understand what education means to our community. When schools are closed, the community's closed. Let's just be very clear. When schools are open and thriving and moving, our community continues to open and thrive. And we're doing this on the backs of teachers. We're doing this on the backs of support professionals and school-based leaders and district leaders. So I think that from my side of it is continue to educate, to push, to be able to galvanize with other superintendents throughout the state, to be able to have conversations with a local delegate or a local delegation, to be able to explain the importance along with the Florida Department of Education, and just continue to hopefully get to a point where it comes available for every individual that's within our organization.
Do you know how many Hillsborough County school staff would qualify for this initiative?
Yeah. So right now we have between 1,200 and 1,300 staff members that will qualify for this Tier 1 approach. And let me be, we would not be able to make this happen without the beautiful partnership that we have with TGH, along with the Department of Health. They have been tremendous during this whole process. As we transition during this pandemic, they have been the experts on this work shoulder to shoulder with us. They've locked their arms, and they continue to dedicate their time, their efforts to make certain that we are creating the safest environment that we can for our employees and at the same time for our learners. So, 1,300 employees, TGH is taking the lead with us. They are sending out communications, started to go out last night around 7:30 in the evening to every one of those individuals that qualify, and they're starting to schedule appointments. And those appointments will take place tomorrow afternoon and the same time on Saturday, just to have an opportunity, if that employee desires, to be able to get the vaccine, so they can have a greater comfort for coming in and serving children every single day.
Where are they going to be doing these? At TGH?
At TGH, yes, sir.
Okay.
They won't be at the schools?
No, ma'am. They will not be at the schools. We just thought it's just a cleaner process to let the professionals take on this. Why, I've been here for 11 months. I feel like I'm a health expert. When it comes to vaccines and being able to do it in a sophisticated manner, being able to leverage their staff. This is a great opportunity for us to strengthen that partnership, and I'm very thankful for them.
Do you know if you're going to get
Absolutely, absolutely. That was one of the biggest things that we've been working on this for weeks. I mean, we were ready a couple of weeks ago. But what we wanted to do is make certain that we had the sufficient number available. And when that time came, TGH stepped up, the Department of Health, and made it available. Then we rolled it out, sending a communication to all of our staff within the last 24 hours to kind of move this really quickly to be able to have that accessibility for them.
So it'll be all that qualify, not just those who qualify with a health condition or?
Yes, ma'am. So we have a number of our employees that have pre-existing health concerns, or they're taking care of a loved one or a family one that may be in their home. So anybody that meets the threshold in the first tier of 65 years or older, then they will have availability to this vaccine.
And again, the idea is just to give school employees priority to make sure with all the issues we've had with people getting the shots that they get them.
This is all about making it a priority for our staff, and as I said, they continue to dedicate their time to service to our children, and I think this just goes a long way to shows that we care, and we're here for them, and we will continue to be their advocates and fight for them to be able to make certain that they have availability and accessibility to the vaccine, especially with the work they do every single day.
Are the people that qualify, have the majority of them signed up?
We have some that have already signed up. It went out late last night, so with TGA starting at 7:30, so we should start seeing that having a staircase approach upward to be able to hopefully fulfill every one of the employees who aspire to do it.
What have been the feedback of the employees?
I mean, I'm getting a lot of emails. They're super excited. They're thankful. They're grateful. A lot of our employees have had a very difficult time to be able to to access the vaccine. And when during the hours that they're available, they're working. So being able to carve out time for them that works for them and do it in a 48-hour period, I think it allows them to have greater flexibility. Openly, we still have a number of individuals that are, do not meet that first tier threshold. They want to have accessibility. I mean, look at our nurses. They're around our children every single day, along with our teachers. So, our hope is that after tier 1, we'll be able to transition to the second phase of it, and to be able to have, whether that's from those who are 64 years of age to 40 years of age, maybe that being a second wave, and then everybody else from 39 to under. And just having a 3-phase tier to be able to have that accessibility. I can't control that or identify that. I can push and advocate for it, which we'll continue to do so.
Has the district started to kind of look ahead at all for when you are able to vaccinate more people? Like some districts are looking at doing it in schools, that kind of thing. Are you starting to talk about that?
Yeah, we have a conversation every week with TGH, USF Health, and Department of Health just to talk about strategy and to be able to create blueprints and vision for this work. As more become available within our community and more come available within Hillsborough County, we then can have a better opportunity to determine what next steps will be. And it's all about training proper staff, and whether we leverage internal staff or our nurses that we have at every one of our schools, or whether we are able to leverage pockets of regional geographical places that individuals can drive through and be able to have accessibility to. That's always in the forefront. We hope it to be sooner than later, but we'll continue to keep everyone apprised of what we have available and what we can and cannot do.
Does this go for e-learning teachers as well?
Any employee that meets the tier 1 threshold, any of them. So if those who are teaching remotely, the answer to that is yes. If they're teaching brick and mortar, the answer to that is yes as well. So we'll continue to make sure that's available.
Does this look like it'll bring more teachers back to brick and mortar?
Well, we started the second second semester on the 19th, and we had a little bit close to 14,000 of our students that came back. So with that said, as students come back, students drive the needs in our schools. So we've had to ask a number of our employees to come back. We're so thankful for them to be able to make that commitment. We see kids, students coming in and out of our schools every single day, depending on where they are from a quarantine perspective, where they are from a medical health perspective. and our teachers as well. So they're doing a fabulous job, and we'll continue to make certain that we provide everyone with the resources they need to be able to continue to be safe every single day in Hillsborough County. We've done a really nice job in Hillsborough keeping our schools safe, and protecting our employees as well.
Mr. Superintendent, prior to working here, I worked in covering news in Lexington, Kentucky. I know that Kentucky has about 4 times fewer the amount of people than the state of Florida, but it also has fewer resources. A teacher I went to school with in Lexington has already been to the minor league ballpark there to get his first shot.
Right.
He's roughly my age. So is this a function, and again, I know you have limited control over
Sure.
when they can get their doses. Is this a function of population, the size of the state? What do you think this is?
You know what, I think it could be a function of the size of Florida. You know, we're massive, and I think it's also about linked to availability and making certain that there's coordinated efforts to be able to serve our communities. We see now that there's particular the conversations about pilots about going in Miami, going in Broward County and Palm Beach, where they're going to start pushing the vaccine out through Publixes. And as you know, there's a Publix every couple miles, and I think that's easily accessible for community members. So our hope is that that will journey up from South Florida up to Hillsborough County, where we can start being a part of this process. So, you know, we know that Tallahassee is working as hard as they can to be able to make it available to our community members, and we'll be right there, lock and step, to being able to be that advocate internally for not only Hillsborough County Public Schools, but for our county at scale in the overall Tampa region.
I'm sorry, did you say how many employees over 65 you have in the district?
Yes, ma'am, between 1,200 and 1,300.
Okay, and do you know which of the vaccines you guys are going to get?
No, ma'am. No, ma'am.
You help TJ for that.
Yeah, TJ, we can get that. All right.
Very
Thank you,
good.
sir.
All right, thank you, everybody.
Thank you.
Yeah, yeah.